Urbanization is a greater force than infectious disease. Our cities and metro areas will survive. If you just go back in history and look at 1918, no antibiotics, no antiviral therapies. Poor people and working people had no healthcare coverage. Not much changes. And I think there's something in that for today. The COVID-19 virus and pandemic reinforces many of the class divides and divisions that have been reshaping our country. There are about a third of us in America who have the great good fortune to be professional workers, knowledge workers. We can come into work remotely and we can isolate safely. There are now 30 million Americans, according to our estimates, that are frontline service workers, grocery clerks, transit workers, emergency responders, who are exposed to this virus not only in their workplace, they're exposed to the virus typically on their transit commutes. If you think about a place that's a laboratory of diversity and density and different kinds of impacts, that would learn from this virus and develop the kind of not only surge capacity, but antiviral regimens. New York will be a laboratory for how we respond. This virus has moved through industrial supply chains, not through supply goods, but through exchange of workers. And the place that they think this virus has actually spread the most is jet set places. You know, the ski slopes of the US Rocky Mountains. What are the factors that make some communities more vulnerable than others? Age. People with higher incomes and more affluent cities and higher income cities tend to be fitter. You have the lowest share of families with children in the home, you have fewer vectors. The shape of our cities and the distribution of activities between cities, suburbs, and rural areas will change. On the pull factors, remote work. Roads are going to get more congested because people are going to not want to take transit. That will be compounded by restrictions on air travel. Clusters like high tech and finance will require proximity. Places that are likely to see a real increase in value and desirability are walkable, bikeable neighborhoods that you can get to existing clusters. How should places think about reopening? This is what I've been spending most of my time doing. You mobilize, you stabilize, you reopen, and you recover. We have to evaluate the impact of this virus on local economy, assess the fiscal impacts, and plan for longer-term recovery. How could you imagine going to LAX in the future? What is the retrofit of transit assets, large-scale civic assets? You just built a new stadium. How can we prepare them safely with health and wellness screenings, temperature checks, PPE, and social distancing? I hate to say this, my kids like Disney Frozen. I could imagine them putting on a little Elsa mask and little Elsa gloves. I know this sounds so silly, but what can we begin to think about? And the same goes for schools. How are we going to get schools ready to reopen in the fall? The thing that small mom and pop businesses are going to need is not just money. They're going to need technical assistance to reopen safely. I've been talking with medical professionals. We're not going to have a waiting room. People are going to go right into the treatment room. We're going to all have protective gear. We're going to have nice protective gear. It doesn't look like a hazmat suit. We're going to do temperature checks. We're going to do pre-screening. People like us can begin to provide demand for local performers, local artists, local chefs to provide personal provision. Frontline service jobs, we got to pay better. We got to make sure our drivers, our delivery workers, our grocery clerks have the PPE they need. This virus is falling so unevenly on communities of disadvantage and communities of color. Those communities are not isolated. Those communities are part of our communities. Building a more just, a more resilient, and a healthier economy is good for all of us.